Hi, welcome to Med Rounds. I'm Dr. Tim Moser, and today's topic is influenza. As you can tell by the background behind me, we're in the middle of flu season. It's late fall, and people are starting to come down with influenza. Influenza, otherwise known as the flu, is a respiratory virus that is very common in the winter months. The symptoms of influenza can strike in a lightning-fast manner and often include the upper respiratory portions of the body: runny nose, cough, sore throat, fever, and body and muscle aches. These symptoms can go from 0 to 60 within hours on an infected individual, and the symptoms may last for well over a week. The influenza virus is a very interesting pathogen in that it can infect not only humans, but also birds and pigs. Think back a couple of years ago. Remember the scare about H1N1? That was a virus that came about through an infection between a pig, later going to a bird, and later being transmitted to the human population. Oftentimes, influenza viruses originate in those populations of the world where people live near pigs and live near birds, especially chickens and ducks. So what's the best way to prevent getting the flu? By far, the most effective preventive measure would be to get an influenza vaccine. It's important to get that in the early to late fall months, starting in October, because the height of flu season is usually in January, February, and March. So you want to give your body a chance to build those antibodies and become immune. Where does flu vaccine come from? Flu vaccine is from chicken eggs. They use the virus, infect the eggs, grow large amounts of the virus, which is later purified and then deactivated. So the flu vaccines that you get with an injection cannot give you the flu. It's inactivated or killed virus vaccine. A second type of immunization would be the nasal spray. The nasal spray uses a live virus. However, this virus has been attenuated or significantly weakened, so it should not cause you to become infected with the flu. Now, we all know somebody who's had a flu shot in the past, and they said, I was fine until I got that flu shot, and then I got the flu. How can that be? Keep in mind that the injectable flu vaccine cannot give you influenza. However, your body's response to that vaccine can cause some flu-like symptoms, some body aches, maybe a little bit of a headache. So the reaction to the vaccine might be causing these flu-like symptoms. Influenza can be fatal. Every flu season, thousands of people worldwide die of the infection or complications from the infection. Those at highest risks are the elderly and those with chronic medical conditions, especially respiratory conditions such as asthma and chronic obstructive pulmonary disease. Another way to avoid getting flu is using proper hygiene techniques. Washing your hands and avoiding, during flu season especially, touching your nose, your eyes, or your mouth without first washing your hands can help prevent transmission of the virus. Once you start developing symptoms of influenza, you are contagious, and you can remain contagious for up to 2 to 3 weeks afterwards. So what's the best treatment for influenza? If you've done all the preventive measures and you're still unlucky enough to get a case of the flu, doing the basics can help get over the flu quicker. The basics include plenty of rest, drinking lots of fluids, and possibly prescription medication, such as Tamiflu or amantadine. Keep in mind that influenza is a virus, and therefore will not be killed by regular antibiotics. However, your doctor may prescribe antibiotics if you have a secondary bacterial infection, such as pneumonia or a sinus infection, that may respond to regular antibiotics. Unfortunately, if you get influenza, you're in for about a week to 10 days of sheer misery and bed rest. This has been Dr. Tim Moser with Med Rounds blog, wishing you health and prosperity in your life. Take care.